considerations in philosophical counseling. Ines is an assistant professor at the University of Zagreb, holding a PhD in philosophy and a master's in Gestalt psychotherapy. She has also completed a primary certificate in logic-based therapy. Her academic interests include logic, the philosophy of language, and the intersection of philosophical and psychotherapeutic approaches. Thank you so much for being here, and whenever you're ready.
Thank you very much for a kind introduction. Okay, I will try to share my presentation with you. I hope that you can see it. Okay. My topic today is ethical consideration in philosophical counseling, and when I talk about something that is connected to either philosophy or psychotherapy or counseling, I like to start with some quote or thought with some famous philosopher. And today I would like to start with something that is originated by Emmanuel Levinas, and he reminds us that every relationship is an ethical relationship. So this perspective is especially relevant when considering the ethical dimensions of philosophical counseling. So the interaction between counselor and client is not merely an exchange of ideas, but a profound encounter that requires responsibility, respect, and sensitivity of the other. This presentation will explore ethical considerations, including the balance between respecting client autonomy and avoiding excessive influence, the maintenance of professional boundaries, and the role of confidentiality in philosophical dialogue. So in this context, special attention will be given to three central topics: the importance of philosophical perspectives in psychotherapy and philosophical counseling, professional boundaries in philosophical counseling and maintaining integrity, and the last one, the ethical responsibility in client selection. So through this discussion, I hope to contribute to the ongoing discourse on the ethical framework necessary for philosophical counseling as a credible and responsible practice. But before continuing, as I come from the Republic of Croatia, I would like to briefly outline the status of psychotherapy and philosophical counseling in Croatia in general. So in the Republic of Croatia, psychotherapy has been a regulated profession since the passage of the 2018 Psychotherapy Act, ensuring clear professional standards and ethical guidelines. The Croatian Chamber of Psychotherapists defines the recognized psychotherapeutical approaches in the country, providing a structured framework for professional practice. However, the professionalization of the philosophical counseling is still in its early stages. Only last year, the first education program in philosophical counseling was launched by the Amygdala Center, which is also partner of the University of Zagreb, marking a significant step towards the recognition of this field. I would like to extend my gratitude to Dr. Elliot Cohen and Samuel Zinajic, who are present here, for their support and collaboration in establishing and organizing this program in Croatia. As philosophical counseling is still developing in Croatia, my perspective here in this presentation will be shaped primarily by this context, particularly in relation to the challenges of professionalization, ethical frameworks, and the integration of philosophical inquiry into advisory practices. So, I would like to start with the importance of philosophical perspectives in psychotherapy and philosophical counseling. Both psychotherapy and philosophical counseling operate within a framework of ethical responsibility and philosophical reflection. While psychotherapy often integrates insights from psychological theories, many theoretical approaches are deeply rooted in philosophical traditions. For instance, Gestalt psychotherapy draws upon phenomenology, particularly Edmund Husserl's concepts of bracketing or epoche, as well as Martin Buber's philosophy of dialogue, especially his distinction between I and thou or I-it relationships. Additionally, Buddhist traditions have influenced Gestalt therapy by emphasizing present-centered awareness and the interconnectedness of experience. Philosophical counseling, on the other hand, employs philosophical reasoning to help clients navigate existential, ethical, and conceptual dilemmas. Given these overlaps, the philosophical assumptions underlying each practice shape the role of the practitioner and the way they engage with clients. So I would like to move on to the theory of situational ethics, which is proposed by psychotherapist Dan Bloom, and who proposes this distinction or the framework that recognizes the ethical complexity of therapeutical relationships. So situational ethics suggests that ethical decision making must be context dependent rather than adhering to rigid moral absolutes. Within this model, Bloom distinguishes three key dimensions. The first one is intrinsic ethics, which includes ethical values which are inherent in the practice itself. In psychotherapy, this includes principles such as beneficence and respect to client autonomy. In philosophical counseling, intrinsic ethics would encompass commitment to rational inquiry, intellectual honesty, and fostering critical self-reflection without imposing external doctrines. The second one is extrinsic ethics, which includes personal beliefs and values. So in psychotherapy, these are the therapist's moral and cultural convictions that may unconsciously influence their work with clients. In philosophical counseling, extrinsic ethics would include the counselor's own philosophical worldview and theoretical framework, such as existentialism, stoicism, or Kantian ethics, and the need to remain aware of how these perspectives shape their guidelines. And the third one is fundamental ethics, which includes clinical knowledge, experience, and relevant codes of ethics. In psychotherapy, this includes professional training, empirical research, and adherence to established guidelines. In philosophical counseling, fundamental ethics would include expertise in philosophical traditions, which also including logic and argumentation, as well as in philosophical counseling, ensuring that the counselor is well equipped to engage in meaningful philosophical dialogue and ethical reasoning. This division highlights the complexity of maintaining ethical integrity, applicable to both therapeutical and philosophical counseling relationships. However, in philosophical counseling, philosophical knowledge does not merely replace clinical expertise, but guide the counselor's methods of reasoning, questioning, and interpreting the client's concerns. A central question that emerges is whether a philosophical counselor, like a psychotherapist, can fully bracket their philosophical perspective when working with clients. Can they, or should they, entirely set aside their own views to maintain neutrality? This issue is especially important when a counselor encounters a client whose worldview significantly differs from their own. For example, can a deeply religious philosophical counselor, for example, if he is a Catholic priest, who strongly believes that only belief in God provides meaningful life, effectively work with an atheist client without their beliefs influencing the interaction, especially if existential meaning is central to the counseling process. While absolute neutrality may be unreachable, a commitment to methodological neutrality, which the counselor facilitates exploration rather than prescribing answers, remains essential. The ability to navigate such differences requires a high degree of self-awareness. Practitioners must critically examine their own philosophical and ethical positions to ensure that they do not unconsciously impose their views on clients. If certain topics prove too challenging for a therapist or counselor to approach without bias, they should recognize these limitations. The failure to do so can diminish the effectiveness of the counseling process. Ultimately, even if the philosophical stance of the practitioner is not something that can be entirely neutralized, it can be consciously managed. This requires a commitment to ongoing reflection, ethical dialogue, and professional development. By fostering an awareness of the interplay between philosophical perspectives and therapeutical practice, we can ensure that both psychotherapy and philosophical counseling remain ethical, inclusive, and truly client-centered. I will move on to the second topic, and this is about professional boundaries in philosophical counseling. So, professional boundaries are essential for safeguarding the integrity of the counselor-client relationship. Boundaries define the counseling framework, distinguishing it from social, romantic, business, and other forms of relationships. Establishing clear boundaries ensures client safety, prevents ethical violations, and maintains professional standards. These boundaries can be categorized as follows. So we have boundaries related to the counselor's role and responsibilities. These include confidentiality, adherence to codes of ethics, appropriate behavior, and respect for the professional framework. And the second one are boundaries related to the counselor-client relationship. These pertain to the nature of interactions, including emotional, physical, and social aspects, ensuring that the relationship remains professional and does not cross the personal territory. So boundary crossing occurs when there is a deviation from traditional professional detachment, sometimes with clinically beneficial intentions such as self-disclosure or non-sexual physical touch. Boundary violations, however, occur when counselors or therapists exploit or harm clients, intentionally or unintentionally. Thus, careful assessment is required before making any acceptations to standard protocols. But let us examine 4 potential scenarios that challenge professional boundaries. So the first one is situation about working with a client. So under a conventional approach, engaging in activities outside of the office setting would be seen as boundary crossing. However, if the client, for instance, struggles with social anxiety, an outdoor session can serve as a therapeutical tool to expose them to public spaces in a controlled manner. So the question is, could such an approach be framed as an intervention rather than a social activity? At what point does this become a boundary issue rather than a therapeutical strategy? The second one is attending the client's graduation ceremony after the client's loss of the parent. So generally, attending a client's personal event would be considering a boundary crossing, as it moves the relationship beyond the professional scope. However, given the emotional significance of the occasion, could there be a way to provide support without compromising professional boundaries, such as, for example, attending only the formal portion of the ceremony? If attending in person is deemed inappropriate, would sending a supportive message beforehand serve as an acceptable alternative? The third one is visiting a terminally ill client at home. In standard practice, home visits are generally discouraged to prevent boundary confusion. However, in cases of severe illness, the client may no longer be able to attend sessions. If continuing the work is in the client's best interest, could one-time structured visit be justified, or would alternative solutions such as online or phone consultations be more appropriate in maintaining professional boundaries? And the last one is allowing a client in crisis to contact the counselor outside of session hours. So a strict boundary would dictate the communication should only occur during scheduled sessions. However, in exceptional cases where a client is undergoing a severe crisis, temporary flexibility might be useful. Would limited check-ins in the form of a short text message without engaging in full counseling help provide reassurance while still maintaining boundaries? How can the frequency and duration of such communication be controlled to prevent over-reliance? And let us move on to the next topic about evaluating boundary crossings. So, in their book, The Virtuous Therapists, Ethical Practice of Counseling and Psychotherapy, Elliot and Gail Cohen highlight the importance of cultivating moral character in therapists and counselors. Instead of treating ethical dilemmas as problems with fixed solutions, professionals must develop virtues such as practical wisdom, or in Greek, phronesis, empathy, honesty, and fairness to make sound ethical judgments in context-dependent solutions. This framework is relevant in discussions of professional boundaries in philosophical counseling. It suggests that practitioners should not only rely on predefined rules, but also cultivate ethical virtues to navigate such dilemmas responsibly. This model also supports the idea that philosophical counselors must develop self-awareness regarding their own values and biases, ensuring they do not unconsciously impose them on clients. In cases where counselors' personal worldview significantly differs from a client's, the emphasis on virtue ethics reinforces the necessity of intellectual humility and ethical reflections in counseling practice. Ethical practice in philosophical counseling, therefore, is not merely about adherence to external guidelines, but also about continuous self-reflection, character development, and the responsible application of philosophical reasoning in client interactions. So here are some guidelines for evaluating boundary crossings. When considering whether crossing a professional boundary may be appropriate in a specific case, the following question may help.
And
So first,
Ines, I just wanted to do a friendly reminder that you have about 5 minutes left
okay, thank you.
for the
Thank you.
presentation.
So the first is about client well-being. So the question is, will the action genuinely benefit the client, or does it risk fostering dependency or confusion about the counselor's role? The second one is about effectiveness or of counseling or therapy. So the question is, will crossing the boundary enhance the therapeutical process, or could it create unnecessary complications in this relationship? The third one is about ability to maintain control. So the question is, can a counselor ensure that the interaction remains within professional limits, or is there a risk of the boundary being crossed further? And the last one about personal readiness of the counselor. So is the counselor comfortable with the action, or does it introduce personal or emotional conflicts that could interfere with professional objectivity? This last one is the most important for the young therapists or counselors. So let us move on to the next and last topic. One distinction between psychotherapy and philosophical counseling can lie in the type of clients that can effectually serve. Psychotherapists, as part of their education, undergo psychiatric training and courses in psychiatry, which provides them with a fundamental understanding of mental health disorders. However, they must carefully assess their competences and limitations, particularly at the beginning of their careers, and ensure that they can work within their scope and practice. Their ability to work with certain conditions depends on adherence to professional guidelines, ongoing supervision, and, when necessary, collaboration with psychiatrists. When philosophical counselors do not aim to treat mental illness, their services can promote positive mental health by addressing moral and existential concerns. Determining the appropriate clients for philosophical counseling requires careful consideration of both practitioners' competences and the client's needs. philosophical counselors must remain awake in recognizing the boundaries of their practice, especially when encountering clients with potential mental health issues. Therefore, clients seeking to explore philosophical questions, ethical dilemmas, or seeking clarity on life choices may be well suited for philosophical counseling, but individuals presenting symptoms indicative of mental health disorders such as severe depression, anxiety, or psychosis might require interventions beyond the scope of philosophical practice. Philosophical counseling is effective with clients who maintain daily functioning and possess the cognitive ability to engage in reflective discourse. Those who experience significant impairments in daily life may benefit more from clinical therapeutical approaches. However, in some cases, philosophical counseling can still play a valuable role as a complementary practice. Nevertheless, the individuals with severe mental health conditions, philosophical counseling should ideally be integrated with other forms of treatment rather than used as a standalone approach. Effective collaboration between mental health professionals ensures that clients receive the appropriate support while benefiting from the distinguished strengths of philosophical inquiry. But the question that arises is the following: how can philosophical counselors effectively determine when a client needs extend beyond the scope of philosophical inquiry? Incorporating training modules focusing on psychiatry into philosophical counseling education, which is already included in some programs, can enhance practitioners' competencies in this area. Moreover, the National Philosophical Counseling Association emphasizing it in its standards of ethical practice that practitioners should recognize the limits of their competence and avoid providing services that fall outside their professional qualifications. This ethical mandate highlights the necessity for philosophical counselors to be well versed in identifying issues that required referral to mental health professionals. By adhering to establishing ethical guidelines, engaging to continuous education, particularly in areas intersecting with mental health, and fostering collaborate relationships with mental health professionals, philosophical counselors can ensure that they provide appropriate and effective support to their client. And let me conclude. So, the ethical considerations explored in this presentation highlight the complexity of philosophical counseling as a distant practice. While philosophical counseling differs from psychotherapy, the boundaries between these two fields are not always clear-cut. Moreover, many psychotherapeutical schools, as discussed, have deep philosophical roots. This underscores the relevance of philosophy in understanding human experience and well-being. Given these intersections, the future development of philosophical counseling can benefit from an interdisciplinary approach that fosters collaboration with experts in psychology, psychotherapy, psychiatry, and other related fields. At the same time, philosophical counseling offers a unique perspective in the landscape of advisory professions. By focusing on conceptual clarity, ethical reflection, and existential meaning, it addresses questions that are often overlooked in conventional therapeutical models. Its strength lies precisely in its ability to engage with deep philosophical issues that shape human life, identity, and purpose, a contribution that remains vital in a world where individuals increasingly seek guidelines not just for well-being, but for intellectual and ethical self-understanding. So here are some main references that I used in preparing this presentation, and thank you very much.
Thank you so much for that wonderful presentation, Ines. We can now open this to the Q&A. If you have any questions, just please unmute your mic.
I think one of the ways to maybe test this boundary issue, because I know that that is tricky in philosophical counseling, and I know many, whether you're dealing with a client who has social anxiety or not, they tend to go out for walks with their clients. Um, or house calls, like in the past, doctors had house visits. Now all of a sudden it's considered like a boundary issue. But I think to make it clear is to be sure that you don't violate the trust issue. And I think that is, instead of having sort of these guidelines and boundaries that are set up and you have to adhere to, I think to be a good philosophical counselor, you have to be very self-reflective in your relationship, like a Buberian relationship with your client, to make sure you don't violate the trust. I think that's a very important point.
Yeah, thank you very much. Well, I didn't mention, but those examples are from either my they are my examples or some examples from my colleagues, but as I'm also a Gestalt therapist, well, this example about walking with a client is borrowed from a colleague of mine. And when we are talking about trust, there is also, I think, one perspective here, and this is not just related to the trust between a therapist or a counselor and the client, but also trust that you have in yourself, and it can sometimes be connected to your family, for example, because this example that I use here is example of my colleague who is also Gestalt therapist, and well, she had a problematic situation with her husband because she went for a walk with her client in at something like 10 p.m. or something like that. So I think it's very important in that kind of situation also to have a strong self-reflection and be aware about
Exactly.
yeah, not just the trust between you and the client, but also trust in yourself and
Yes, yes.
members have in you. Yeah.
No, absolutely. That's why I said it's important for the counselor to be self-reflective enough
Yeah.
to understand that things can be misinterpreted and misconceived. So yes, to make sure that the trust, not just with one other person, but is not violated.
Yeah, that's true. Thank you.
At the same time, there are legal parameters too for uh, philosophical counselors practicing outside of their areas of specialization or training. And for
Sure.
instance, in the United States, as in Croatia, you mentioned, there are laws that specify what sort of things that you can do. And so it goes beyond trust. You've got to know, what criteria to to adhere to. And to its credit, the MPCA publishes and teaches criteria for referral. So, for instance, if a client has suicidal ideation and has a history of suicide, for instance, attempting suicide, it would be there if they had a history of suicide. But so if indeed they have that kind of history of trying to kill themselves, that would be on a client to refer. And NPCA and the Institute also emphasize, as you rightly mentioned, the need to have colleagues, in the psychotherapeutic community with whom you work. So if you have a question about whether this client satisfies these standards or not, you can speak to that individual and get feedback. So it should move in a direction of working together with the psychotherapeutic community, and not individually and not separately from it. And I think that's important to mention that NPCA is the only association that has formal criteria of referral. And it's built into the LBT training program, as you know, so that's.
Well, I just need to jump in here and clarify. I mean, I'm not talking about trust just in a sort of blind trust kind of way. When I set up my first practice in '86 in the United States, I worked together, I shared an office with a psychiatrist or psychologist. And the whole point was that, or he gave me time to work within his office. The point was that it would be very clear that if I could not, if I felt that the person needed more than what I could offer, I could refer that person across the hall to the psychologist. But there are also examples in my practice where a person who was schizophrenic always sought me out after he had met with his psychiatrist and said, Maria, I have to talk to you because after talking to you, I feel normal again. Then there was another example of a woman who was suicidal, went to the Harvard clinic, was prescribed these pills, got even worse. And someone said to Maria, Maria, you need to talk to her. And so I was able to actually turn the situation around. And years later, she said, Maria, you saved my life. So there are tricky situations where you cannot just put very clear boundaries. If you really want to help a person, sometimes you have to, and that's where the trust comes in, that you don't just say, I'm going to hide behind my professionalism, I'm going to hide behind the boundaries, I'm going to do what's right, even if it's at the expense of the client. Sometimes you have to take risks.
Well, it sounds to me like you were being supervised or being overseen, by a psychotherapist, so that you weren't working
That
on
was
your
only
own.
in the beginning. The other two examples, I was on my own, not supervised.
Well, it's good that you helped someone, but it could have gone the other way around.
I know it. I know it. And I'm not, and that's where a lot of people, I think, will be too stringent and strict. And that's the only reason I'm bringing it up, is because, I really feel that at some point, too many people hide behind their professionalism and say, I can't help you. My hands are tied. I don't want to be sent to court. And so initially, and essentially the client is just left hanging. And I've seen too many examples of that.
Maria, there's a difference, it's a Rawlsian difference between justifying a practice and justifying an instance under a practice. And although there may be instances of justifying, individual action, speaking in the, the sense in which, we're talking about here, which Ines is referring to, or the institutionalization of philosophical practice. The question is, what kind of practices do you want? What kind of practice rules do you want?
Okay, point well taken.
Say,
Yeah, no, I respect that, and I do. And so, but I also want to give room to compassion.
Well, we wouldn't want to do it without compassion, most definitely. So we agree there. Thank you.
I am hyper aware of the ethical boundaries in LBT and in counseling, and that is one of the reasons why I started pursuing a degree in psychological counseling, because I was thinking I really would like to do more, but I also understand like the scope. And yeah, I think just putting the client first is always the most important thing. Obviously, also your well-being, but something that resonated a lot with me regarding Ines's presentation is she didn't use this language, but I find that she was referring to transference and countertransference, like making sure that we are not influencing the client in ways that we shouldn't with our biases if we're unaware of our biases. And I think that's like almost like a lifelong journey of constant questioning ourselves and learning. But it's definitely, I think, necessary to be able to provide better care for the individuals that we that seek our services.
Yeah. Yeah, this was one of the points. Yeah. Because I really think that both in psychotherapy and counseling, it's very important to, as Husserl said, put your attitudes and everything in brackets, because this is the only way that you can be present here and now for your client, and just well, he or she will be available to express their feelings and attitudes and everything. So well, as I worked at the faculty where there is a lot of priests, and some of the priests that work with me, they're also psychotherapists. We often discuss about that kind of topics. So this is one example that I use here. So what if somebody is a Catholic priest and he has a client who is an atheist, and maybe it shouldn't be important if this is not a topic, but maybe this can be a topic of one point of the psychotherapy or counseling. So how he can deal with it. And well, one colleague of mine who also has a certificate in LBT, he said to me a few months ago, well, I really have a problem with this, because if I have a client who is an atheist and I'm a priest, and there is something, this is some kind of a pink elephant in the room always. So there is a problem somehow. So, but okay, he's a psychodynamic therapist and also priest, and well, he can deal with this, but there is always something. So I think that we as a therapist and counselors always have to be aware of that fact. And of course, all of us have some attitudes about, for example, abortion or some other ethically relevant topics. So I think it's very important to be aware of that. And one of the teachers in my education in Gestalt psychotherapy, she said that if there is some issue that that is important to you and you didn't concentrate on it in your process of your education, then some of your clients will come with that topic and he or she will bring this to you. So you will have to deal with it sometimes.
Yep, that's right. And you don't want to be stuck with labels either. He's Catholic and she's an atheist.
Yeah.
I'm an atheist married to a priest. How does that work? So, if you just want to label people, you're not going to get very far. And I think if you really want to get into the philosophizing, you have to be able to look beyond just the stereotypical labels.
I would like to put my 50 cents on this Catholic atheist and this kind of topic. I believe that I heard so many times the boundaries in Ines's presentation that I was questioning what is then the authentic the philosophy as a way of living, if we are concerned about some professional guideline and boundaries, because I think in philosophy there is no one size fits all, and we have to adapt everything for the client, for the one who we are interacting with. And I see religion also as a philosophical framework. So when Thales was famously said that everything is water, we have to see how Jesus was walking on the water, what Thales said, that everything is water. So basically, Jesus was able to go and cross those boundaries and tackle the ego and the limitations of the self. And I think in philosophical counseling, this is the aim. I think we should be able to recognize on the fly the patterns what we are seeing, and make a quick diagnosis or an idea of what led the person in front of us in that scenario of the life, or to have that problem, and doesn't see the solution or seek an answer for a problem, and be able to improvise without and be aware that this transference, counter transference things is happening anyway. So and then we should have healthy boundaries on that sense. And I mean, having 2 ears, in one to enter, on the other one to go out, but in the same time to listen, be hyper aware of what the client or the interlocutor is saying. So I think, and in this sense, once somebody sees philosophy as a way of living, then he's a
Yep.
philosopher on the street on 10 p.m. And when the husband is asking at 11 p.m., "Oh, what was at 10 p.m., then I should know at 10 p.m. what's going to be at 11 p.m. at home, or whatever. So just I think that
Yeah.
the religion doesn't knocks out the
Philosophy.
philosophy, or
Right.
vice versa.
Yeah. Excellent. I think that's very true.
I would like to let Dr. Cohen um, maybe close out this session for us. And then we will be ready for Sam for our next session.
Close out in what respect?
If there's a final comment to
Oh, okay. Yeah. Yeah. I really appreciated Ines's talk. I think it addressed the central, challenges in ethics. And for a profession to be a profession, it needs ethical standards, and boundary issues are, really significant. For instance, like going, having a personal relationship with a client is problematic because you lose your objectivity. Counseling students, for instance, that's a big
Right.
one. A lot of philosophical practitioners are, work as teachers, and some I've seen this happen, and they had to be told, no, you can't do that. Try to
Right. Yeah.
recruit, try to recruit, their clients from their classrooms. And, in dual role relationships, the problem is there's an unequal relationship, and there's also, problems of being objective. The expectations are different on each side. Student is being graded, and so forth. And it raises questions, there's some questions that arise even with former students, if you know things about them as a student, but what about the other way around? If it's a former client, what happens if they end up in your classroom? And sometimes you can't do much about that. And so that's, you know, you sort of back into it. You take somebody on as a client, and then they end up in your classroom. And so one thing that we do is caution, instructors, that if you think that you're going to have this, if you have some foreknowledge that this person, you're teaching a certain course and they have to take it, and they're going to end up in your class, you don't take them as a client, because then you end up in that situation. So these are things that, are grist for the mill of discussion, and professionalization requires, that we address them,
Yeah. Exactly.
Yeah. So I think Ines hit a lot of nails on the head by talking about these these important issues. So thank you so much for that enlightening discussion.
Thank you very much.
And I will now let Sam chair the next session.
All righty. Thank you for all your help today, Deborah.
Of
Really
course, no
appreciate it.
problem.
Yeah, thank you so much.
It's a joy.